A linear array transducer with a nerve exam type is used to perform an ultrasound-guided interscalene nerve block. The target depth is approximately 1 to 3 centimeters in an 80-kilogram adult. The patient is positioned in a 45-degree reclining position with a pillow under their head and the head turned toward the contralateral side. The examination begins by finding the supraclavicular region of the brachial plexus as a landmark technique. The transducer is placed posterior to the midpoint of the clavicle with the orientation marker directed to the patient's right at a 3 o'clock position. The subclavian artery is seen as a round, pulsatile structure superior to the bright reflection of the first rib. The pleura is seen as a bright hyperechoic reflection deep to or at the same depth as the first rib. The nerves of the brachial plexus are posterior or superior to the subclavian artery. The nerves appear as hypoechoic dark circles within the bright hyperechoic fascia surrounding the brachial plexus. To identify the interscalene region of the brachial plexus, slowly slide the transducer up the neck. The interscalene muscles will frame the nerves within the interscalene groove. The nerves will change in shape from a grape-like cluster in the supraclavicular region to a chain-link appearance in the interscalene groove. The C5 and C6 nerve roots appear as 3 circles. The hypoechoic pulsatile carotid artery will appear medial to the anterior scalene muscle. The needle can be advanced using an in-plane or out-of-plane technique. For an in-plane technique, the needle is positioned 1 to 2 centimeters lateral to the transducer and advanced under the transducer until the tip is just posterior to or between the C5 and C6 nerve roots. The local anesthetic is injected incrementally close to the nerve roots. The needle can be redirected if the spread of local anesthetic is not deemed adequate. It is not necessary to have local anesthetic anterior and posterior to the nerve roots. Posterior spread only of local anesthetic is effective.